Your Excellency, distinguished ladies and gentlemen, please, we're about to kick off. If you are coming in, please come in and take your seats. All right, so controls, if you can hear me, shall we all rise now for the national anthem, please? Thank you very much. Let's be seated, please. Your Excellency, the former governor of Ekiti State, former chairman of the Nigerian Governors Forum, the honorable commissioners from all over Nigeria, those that are taking care of the health of our people at the sub-national level, our development partners that are here, distinguished guests, ladies and gentlemen. Ebere Young is my name. Let me invite the professor of MCing in the country. She's our mother, but a very loved one at that, Mrs. Mojima Konjola, to set the tone.
Thank you very much, Ebere. Health is everyone's business. Your Excellencies all, honorable commissioners, development partners, the Nigerian Governors Forum, very, very distinguished ladies and gentlemen. I have here written something which I've been debating whether I should say it at the end of this meeting today, day one, or I should go ahead and just say it immediately. But I think, yeah, okay, say it. It's democracy, all right. So I said, thank you for being here to wake up a sleeping giant. Thank you for affirming that greatness in our healthcare can be restored. Thank you for committing to improving the health status of all Nigerians, and thank you most of all for helping create health equity. I will explain my assertions. Strengthening the capacity of health leadership for strategic, intersectoral, and social political management of the health systems has undeniably become an imperative, and I'm sure that's why we're here. Today's forum will gear health leadership towards achieving better health outcomes at the sub-national levels and to roll up and translate to better national health index. Bridge the trust and translate to better national health index. We need to fill the deficit gaps in our health system, engender high functionality, translate into social economic wealth, long-term, and generally enhance the legendary Nigerian human resilience. It will, when done well, even promote health-seeking behavior and facilitate better access to greater health service delivery. It potentially can restore us to greatness in the health space of when other clients sought health care at UCH in those golden days. Your Excellencies all and our partners, distinguished ladies and gentlemen, we can revolutionize healthcare in Nigeria from today's event. Permit me, therefore, to welcome all of us to concerted, coalition effort of health leadership to administer, if I dare say, CPR to our dying health system. Profound health history will be made here today going forward, and we are all part of making health work for our collective greatness. I welcome you. This is my assertion. This is the hope of Nigerians, that with all the health commissioners here present, we would be able to put together workable, doable, and actionable things that will push healthcare forward and make healthcare an imperative for investment for development. Mujima Kochola, I welcome you. Well, I hope we don't have the fever of the CPR not have been administered or about to be administered. So please, you can be generous with your with the applause. Having laid this foundation for a wonderful day, I hope, and looking through the next 48 hours, let me invite one of my most admired Nigerian. And when you choose or when you work with somebody who you know has potentials to build, then that can be a continuum so that we don't have a break. One of the best people who did that is the immediate past former governor of Ekiti State. He saw a young man and gave him a responsibility and said, go get it. And so Ekiti State stands out today as one of those states that you can benchmark on development. I'd like to call on Dr. Oyebanji Filani. He was even called back to service. Having served with Dr. Fayemi, the new governor of Ekiti State said, you can't go, just come back and continue the work. I'm very proud of you.
Thank you very much, and good morning, everyone. Your Excellency, my own very boss, Dr. Kayode Fayemi, my colleagues, members of the Development Partner Group, and everyone who is present today. It is a great pleasure for me to welcome you all to this induction ceremony for Commissioners of Health. This event, themed National Health Leadership from Promise to Impact, marks a significant milestone in our collective journey towards a healthier, more prosperous Nigeria. I think it's important to say that this is the first of its kind. We've never had this at any point in time. I welcome you today as the chair of the Nigerian Commissioners for Health Forum, an organization that has undergone a remarkable transformation in recent years. What started as a body seeking better engagement with federal authorities has evolved into a dynamic knowledge tank of subnational health leaders. I must, at this point, acknowledge Dr. Mustafa Jubro, who was the first chairperson of this forum, and Professor Adewale, who at the time, as the minister, when he heard about this, said, I'll do whatever it takes to ensure we support this forum. The forum is unified by a vision to significantly improve health outcomes in Nigeria using data, peer learning, stewardship, and accountability. This evolution has been driven by a shared commitment to foster collaboration, innovation, and excellence within the health system in all 36 states plus one of the Federation. Central to our vision is the Nigerian State Health Leadership Collaborative, an initiative that exemplifies the power of collective action. Within the framework of the Nigerian State Health Leadership Collaborative, health commissioners harness the insights derived from data and apply them in our state to address common challenges. Together, we have identified transformational opportunities that can significantly enhance the performance of our health systems. But more importantly, we ensure that the outcomes of these initiatives are measurable and can be tracked across states to ensure accountability in our endeavors. At present, the collaborative boasts of 3 flagship programs, each designed to foster learning, facilitate collaboration, and drive meaningful change. The first of these programs, is the annual Primary Healthcare Forum, which serves as a platform for sharing best practices and innovative solutions in primary healthcare delivery, enabling us to strengthen the foundation of the healthcare system. The second program is the Top Team Effectiveness Learning Platform, which equips our members with the skills and knowledge necessary for navigating the complexities of the healthcare management platform. Lastly, the forum convenes on a quarterly collaborative meeting of health commissioners to facilitate dialogue, cooperation, and peer learning, laying the groundwork for the sustainable progress for the Nigerian health system at large. The aim of this ceremony today is simply to equip commissioners of health with the knowledge, skills, and ethical foundations necessary for good governance. This aim is deeply rooted in our desire to bolster the capacity of health commissioners in the strategic, intersectoral, and socio-political management of health systems. Considering the change of leadership following the just concluded general elections in May, our focus is currently to equip the new cadre of health leaders with the tools and insights essential for effective governance. This retreat is critical as we transition from the fervor of electioneering to the practical responsibility of governance, where decisions made today will shape the landscape of the health sector tomorrow. The daily challenges faced by health commissioners are multifaceted, ranging from technical and administrative hurdles to navigating the complex political landscapes. To surmount these challenges, commissioners need a profound understanding of the complex and dynamic healthcare landscape in Nigeria, and this induction ceremony is designed to equip them with the practical tools and insights necessary for addressing the challenges ahead. The panels, caravan sessions, and the networking opportunities have been curated to offer actionable strategies that are grounded in experience. By engaging in these sessions, the commissioners will gain invaluable insights, enabling them to stay ahead of the curve in the course of their job. The induction ceremony is not merely a one-time event. It is the beginning of a lasting engagement. As a forum, we will continue to provide support to our members through periodic engagements and our flagship programs to ensure that every state is well positioned in their journey towards universal health coverage. I must take a moment to thank the entire members of the Planning Committee, Dr. Tomi Koka, Dr. Amina Baloni, Dr. Emmanuel Obi, Dr. Ahmad Abdulwahab, and the entire member of the NGF team for powering this event and ensuring that, we've worked diligently behind the scenes to get today to fruition. In conclusion, I extend my heartfelt gratitude to all of you for your unwavering support and dedication to public health in Nigeria. Together, we are not only navigating the complexities of health leadership, but also transforming our promises into measurable impact. I'm confident that the discussions, insights, and collaborations that emerge from this event will pave the way for a healthier and more resilient Nigeria. Thank you, and I wish you all a very fruitful and inspiring experience at this induction ceremony. God bless.
His idea was, after this induction, to have a healthier nation. But the applause is not healthy. Okay, the doctors here have injected the applause, and now it is healthy. Thank you very much, Dr. Filani. We appreciate you. Thank you. Your Excellency, distinguished ladies and gentlemen, between Mrs. Mujima Konjola and Dr. Filani, they have set the tone why we're here. And I totally believe that this induction will help us to restore a minimum level of provision of basic health services at a sub-national level. Because the gravity of the country's health is directly linked to the level of poverty. So for what you are doing across the nation, we say thank you to you, those primary health centers, those pregnant women, those children who can't afford anything, but we are keeping them healthy, the farmers going to the farm. For you doing all of this, can you put your hands together for yourselves? The nation is absolutely proud of you. And so from here, we'll take on the goodwill messages, and we'll be kicking off with the World Health Organization. Dr. Walter Kazidi Mulumbo is here. We've been working with a committee to give him a Nigerian name because he's been here for a very long time. Dr. Mulumbo, I yield the microphone to you.
Thank you, the MC. I've been here for a long time and I'm here to stay. Thank you, Your Excellency, distinguished guests, Honourable Commissioners for Health, and other delegates. It's truly a pleasure for me to join today at the induction of the newly appointed State Commissioners for Health with the theme, Navigating Health Leadership from Promise to Impact. This event is critical, as it has been designed to equip the new health leaders with the clear perspective required for the effective discharge of their duties in line with the renewed hope agenda of this administration. Let me first congratulate you on your appointment as commissioners in your respective state. This, as you are aware, has placed enormous responsibilities upon your shoulders toward the achievement of universal health coverage and health security in Nigeria. Considering the political economy of the country, your position is unique in steering your state toward the right direction in line with the federal government policies and agenda, despite the prevailing challenges based on your state-specific context. Distinguished guests, Your Excellencies, ladies and gentlemen, the health situation in Nigeria requires uncommon approaches to make a difference. With the ongoing increase in the burden of non-communicable diseases, on the background of high burden of communicable diseases, multiple outbreaks, and the highest out-of-pocket expenditure on health in the region, more Nigerians are falling into poverty due to ill health, while many do not have access to the quality essential health services they need. Rising from the international conference to celebrate the 45th anniversary of Almata and 5th anniversary of Astana Declaration on Primary Health Care in Astana, Kazakhstan last week, countries have recommitted themselves to making a radical shift toward primary health care as the foundation of universal health coverage and health security. The separation between primary health care and health security is truly artificial, we've realized. This indeed entails shifting the focus from mere concept to action with demonstrable result for greater resilience in the health sector, even in the face of emergencies. As leaders of health sector, very close to the people, it's demanded of you now more than ever to keep PHCI on the agenda of your government and ensure priority investment in its development. At this point, I wish to appreciate the Honourable Coordinating Minister of Health and Social Welfare for his leadership in providing the strategic directions for reform in the health sector. I'm confident that with a common visions, proactive collaboration, clear accountability mechanism, collective dedication, and commitment, we will achieve better results in the health sector together. WHO, in line with our country cooperation strategy, is committed to working with you at the federal level and the state level through our field offices, which are spread across all the state and FCT, to ensure the transition of health policy in these directions into action. Finally, let me congratulate the leadership of the State Commissioners for Health for putting this induction ceremony together. While I wish you fruitful deliberation, it's my hope that your objective will be met at the end of this important two-day event. I thank you for your attention.
Thank you very much. And thank you for reminding us that we need to find new ways, a radical way to address the issue of primary health care. And I like the fact that you also spoke to health security and financing. God help us if you have a relative that is struck with cancer and you do not have any support from the health insurance. That's one sure way to poverty. And I can tell you that a lot of us, even here, have some experience or are experiencing that. We want to thank our development partners for the reminder out there and thank the WHO country representative. I was reliably informed 2 nights ago that he's the most traveled country representative that we have here. So I think he deserves a round of applause. Yes, we go on quickly and we'll ask our partners from who have been also very supportive of health development in Nigeria, the USAID Nigeria. I'd like to invite the Health Office Director, Sinu Kurien, who is going to give a goodwill message. Please, can we all welcome her warmly?
Thank you so much. Good morning, everyone. His Excellency, the immediate past governor of Ekiti State and former chairman of the Nigerian Governors Forum, Dr. Kayode Fayemi, and development partners, and of course, the wonderful newly appointed 36 health commissioners. Thank you for having us here this morning. On behalf of the United States Agency for International Development, USAID, we stand to congratulate all of you on your new appointments across Nigeria. Thank you for all that you do and that you will do. Achieving high-performing health systems, preventing child and maternal deaths, controlling the HIV epidemic, combating infectious disease begins with having strong leadership in place. Honorable Commissioners of Health, it will take bold and visionary leadership to drive the transformation required to transform Nigeria's health sector. Today, Nigeria needs health leaders like all of you who can imagine that change and that can make it happen. We are all too familiar with the challenges in the health sector, and we look forward to partnering with all of you as you jointly find solutions to overcome some of these challenges and to find more appropriate solutions and context-delivered solutions. As a leader in global health, the U.S. government, through the United States Agency for International Development, remains committed